So, good morning, everyone, and welcome to our webinar titled Aging Ebony, Living Authentically Through a Legacy of Strength in the Black and HIV positive trans community. We're so happy to have you here, have you join us, and we really hope that you are doing well. Thank you for taking the time out of your day to be here. So in today's webinar, what we're going to be doing is we're going to be highlighting an array of unique needs and concerns of the Black transgender folks aging with HIV, while addressing the systemic barriers and stigma and gaps that exist in healthcare that also contribute to their invisibility within the health system, right? In this webinar, we'll have speakers with lived experiences who can share a little bit more with providers about, how they can treat better and work better with this population. So that being said, we also want to thank our partners at the SFDPH HHS faculty for making this webinar possible as we're collaborating with them. So with that being said, welcome. A little bit about me. My name is Fabian Moreta Avila. I use he, him pronouns. I'm a bilingual trainer and curriculum writer here at the UCSF Alliance Health Project, specifically for the provider training unit. And today I'm joined by my colleague and trainer, moderator, Daryl McIlvain. Um, so Before we move forward, please note that this session is being recorded. So if you, for whatever reason, were not able to make it today, a link to the recording will be shared with all participants at the end of the webinar. All right. So without further ado, I'm going to be presenting our speakers for today. So like I mentioned, and just keep in mind, this webinar features a distinguished panel of experts, advocates, and individuals with lived experience who will help guide the conversation about the complexities, the resourcefulness surrounding HIV and how this impacts the health and well-being of Black transgender people. But also, when we talk about that, we also mention the resourcefulness, like what are the services out there that this population can access, and how can they navigate those systems. So we look forward to an engaging and respectful conversation today. With that being said, we want to present our first speaker for today, who is Soleil Rodriguez, she, her. Soleil is the program manager for Trans Access, which is an innovative HIV case management program at the San Francisco Community Health Center. She began her journey in community organizing in Bakersfield, California, before earning a degree in political science and public service from UC Davis. While in college, she served as a community coordinator and student advocate at the university's LGBTQ Research Center and completed a gender health internship with the Sacramento Gender Health Center. After graduating, she worked as a case manager with the SF Community Health Center's GTZ home team, where she learned to provide care through harm reduction, cultural humility, and trauma-informed approaches. With 5 years in community work experience, she effectively leads her team in serving their community. Recently, she has taken on a new role within the Project Transition Program, which is a 2-week hotel voucher program. These experiences have shaped her commitment to advocating for her community. Next up is Mia Mitchell, she, her. Mia is a medical case manager for the Trans Access team at the San Francisco Community Health Center. She was once a client of Trans Access and is considered one of the program's success stories. At 35, she's living her trans identity in San Francisco and is originally from Lake Charles, Louisiana. In 2021, when she first moved to San Francisco, she was new to the city and she let her heart guide her decisions. That leap of faith brought her to where she is today. She began her work through the Community Ambassador Program at SFCHC and later participated in the Community Health Worker Internship at CFCCC. Mia graduated from the College City of San Francisco in 2024 with a 3.3 GPA, having completed her case management certification the previous year. Since then, she has served as a case manager providing comprehensive care for San Francisco's most vulnerable populations. Mia is dedicated to improving services for her community and ensuring they stay connected to healthcare. Her lived experiences as a former client gives her unique insights into engaging and retaining clients, especially young women. Last but never least is Erica Reyes. Erica is a California native. She has been working with the San Francisco Community Health Center for almost 6 years now. Originally a client of the agency for 16 years, she's now working for the agency as a medical case manager as and program supervisor of trans services with Trans Thrives program. So we welcome these ladies into our webinar, and we are super excited to hear their professional input, experiences, and stories. So without further ado, Slay, take it away.
Sweet. Thank you so much, Fabian. Let me go ahead and share my screen. Perfect. Okay. Can y'all see it okay? Sweet.
Yes.
All right. Thank you all so much for having us today. It is an honor to be able to talk to one of the resources that is available in the city of San Francisco to Black trans women living with HIV or AIDS. And I am joined with my lovely case managers and teammates, Mia Mitchell and Erica Reyes, and together we make up Trans Access. Trans Access is a program where we enhance, engage, and retain trans women of color in HIV care. So to talk a little bit about our team, um, as I was mentioning, there is the three of us. I serve as the program manager. I am essentially the support person for Mia and Erica. I help and make sure that things are running smoothly behind the scenes. And then I am also here to be an extra support person for any patients and clients as they come in and if they need a little extra help. Erica and Mia are honestly like the main reasons why our program was able to thrive and serve as many of our goals as we can. Without their case management, I don't think we would have as much to speak to, or we wouldn't see as much of the impact that is made. They primarily provide service and medical resource navigation. So this can look like getting support with general assistance, SSI, housing, navigating medical appointments. We have another slide that will talk a little bit more about this in depth. And then someone else that is not here today, but her name is Shalini. She's our associate social worker. She's a recent addition to our team and has been a really, really big aid in providing dire needed clinical counseling and behavioral health support to our girls. She is stationed with us during our drop-in clinic, which we'll talk about later. And she also holds regular appointments with a handful of our girls. So to talk a little bit about the history and background of Trans Access, Trans Access is a part of HIV services here at SFCHC and works in tandem with other revolutionary HIV health programs like GTZ and Home, the Black Health Center of Excellence, and TASTE, the Tenderloin Area Center of Excellence. And together as a department, we provide wraparound services and a safety net for San Francisco's most vulnerable patients. TransAccess had first launched back in 2013 as a collaboration with Tom Little Urban Health Center, and within its first few years, it was able to successfully engage 80 different trans women of color living in the Tenderloin neighborhood. The women at that time were evaluated at the 12-month and 24-month evaluation points and showed significant improvement in their antiretroviral therapy, prescription, and viral suppression rates. Since then, Trans Access has only continued to change the narrative for trans women of color living with HIV or AIDS, and it was recognized in 2024 as a part of the Ryan White HIV and AIDS program compilation of best practices. And I think this is a really, really big achievement, and I love to talk about this because a part of the reason why our program received this recognition is because of the work and the quality of care that both Erica and Mia provide. What recognition was bestowed upon the program before I had stepped in as a program manager. And so this is something that the two of them earned, and they were holding it down for such a long time, and I'm very, very proud of them. And yeah, that's a little bit about Trans Access. In addition to that, we received a additional program, which is Project Transition. It's a temporary hotel voucher program that supports clients with a hotel stay, whether it's for gender-affirming surgery, whether it's for to serve as a transitional housing opportunity. The idea is just to help us find and serve homeless trans and gender nonconforming people living in San Francisco. And I am going to go ahead and pass it over to Erica to talk a little bit about our program overview.
Hi, everyone. So, program overview. So, Trans Access is a program designed to promote better health for transgender women of color living with HIV in San Francisco. So, we have a drop-in clinic, which is every Thursday from 2 to 5 p.m. And Monday through Friday, we have our morning drop-in, which is from 9 to 11:30 p.m. A.m., I'm sorry. People can come in and they can ask for either me or Mia. This is the time that me and Mia can meet with patients to help them with whatever needs they have at that particular time. Or we actually we do DOT with some of the patients. They come in during our morning drop-in when they get breakfast. Let's see. Also, I mean, the drop-in also provides like case management. We have hot meals, a hot breakfast every morning, and also harm reduction supplies they can pick up there. And if we have special events, we have special events during that time as well, and also peer support. The Thursday drop-in, we have our primary care clinic. We have nursing support, and we have, if we need to work certain patients that need help with, what do you call it, being adherent to medications, me and Mia will meet with them to either have them come in every day or once a week to pick up meds, a week's amount of work of meds, so we can just keep them on track to keep them undetectable. And also, we counsel and peer support our patients when needed. That's it.
Do you want to talk a little bit about the core values, Erica?
So, TransAccess believes that our community deserves to thrive. We strive to provide our clients with comprehensive and culturally affirming care to support them no matter where they are when they come to us. Some of the values that guide us as we do this work are, being trans affirming, of course, self-actualizing services, harm reduction, community and patient centered, and also radical healthcare.
And to add a little bit to this, I think these are some of the most important values that guide us in this work. And I think a part of the reason why Trans Access has been so successful as a program is because these are all the things that we focus on and strive to provide in our care. And I think one of the biggest things is, and to really emphasize the component of, we will work with girls no matter what their history is, no matter where they come from. Some girls could have a complex distrust in the medical system. They could have maybe different anxieties around going to clinics or being in a four-wall space. We try to find solutions to the barriers that come up, and we try to identify that with each of our girls. And there's also a level of cultural competency that goes into that. There's a way, I feel like, when you come from community, you have a different ability to engage with our sisters, and it is a really special thing. And I know, like, for each of us, we have our own lived experiences navigating the medical system during our transitions, and we use that also as experience to relate to the girls that we serve. Um, and it's a very, very, very special thing. And I really strongly believe in this program and all the work that we get to do. And I really do think of our work as radical healthcare. There is not too many other places that I know that do it in this way and have such flexibility. Like, we try to be as low barrier as possible. When it comes down to harm reduction, I think harm reduction can apply to so many different things. It can extend beyond just substance use and can go into a person's healthcare and daily lives. And it's one of the, I would say, like, most utilized of our values, where we constantly are checking in and trying to reduce the harm that our clients might experience. And then to talk a little bit about the impact on ART, from September 1st of 2024 to February 28th of 2025, TransAccess served 34 total unduplicated clients, and these were some of the stats that showed the impact of our program. So from this period, 65% of our patients were undetectable, and this was either they were undetectable during this time or we got them to undetectable status. 83% of our patients are actively on antiretroviral therapy, and 17% of those patients are on a long-acting injectable. And in addition to these things, one thing that I think is really special about our program is that patients and their partners or family members can also receive support from our program. And this is primarily with either accessing ART or PrEP, things to keep them safe and to keep them healthy. And it also taps into our approach and the way we view providing healthcare to people. We try to really focus on the whole person, you know, their housing, their loved ones. Like there's so many factors that encompass a person's lived experience and the way that they navigate the health system. And we try to focus and support them in all of those areas. To talk a little bit about the points of entry, there's a couple of ways for patients to be referred to us and to get connected to care. First and foremost, for anyone that is, I guess what I would recommend is to send an email to our department at hivservices@sfcommunityhealth.org. Essentially, if you were to send a message to this email, our director of the department, Robert Arnold and Joshua Laurel, they are the ones that oversee any of the referrals or messages that go there. They would essentially send over the forms, ask and do that initial coordination, and then they would triage the referral and let us know basically where they think the person would be a good fit. Or they could also come through on a walk-in basis. Some of the most common ways that we've received referrals are through primary care physicians and hospitals. Patients can be referred to our team, and through those ways, they can either keep, in the cases of a PCP, they can either keep their primary care provider if it's with someone outside of SFCHC, or they could switch to our provider that works specifically with our program. His name is Dr. Lin. He's a really, really great physician. He has a lot of experience working with the trans community, and I think also his partnership is a part of the reason why our program is so successful, is he's provided this care within the city of San Francisco for such a long time. We've received some referrals from hospitals, and I think that's another thing that's really special about our program and really exhibits our flexibility. A couple of our girls, we have received referrals for them, and then we'll go to the hospitals wherever they are and do an intake with them, and we'll get the ball rolling while they're still engaged in receiving care. And we try to create a plan or an exit for them when they're in the hospital. One of the biggest ways, and I think really attests to the level of care that our team provides, is we've gotten a lot of referrals from community members. A lot of our current enrolled participants, they will bring in their girls. They'll bring in their sisters and let them know, like, they'll come up to us and say, like, this is X and X, and how can we get them connected to care with TransAccess? Like, we want them to get the same benefits and service navigation and all those resources that they and themselves have received. And I think having so many of those referrals really shows the level of care that Erica and Mia provide. And then in addition to that, we've received some referrals from community partners. So this can be from staff and folks from outside of our org. This can look like receiving referrals from the SF LGBT Center or from Ella para Trans Latinas, different outside orgs and places. It's a really, really special thing. And then I am going to let Mia talk a little bit about the client identification and to focus on this.
For our client identification, to be eligible for trans access, these are some of the characteristics we look for. I know it can seem extensive, but like only two of the characteristics are the main characteristics: living with HIV and woman of color. Multiple diagnoses, experiencing homelessness, history of disengagement from care, difficulty managing medication, and new to San Francisco. So with the multiple diagnoses, that's when you're dealing with mental health. So we need a mental health component. We're dealing with trans people, gender dysphoria. As far as hair care for their face, laser treatment, experiencing homelessness because we do help with housing. And also the disengagement with the history of disengagement from care, like if no one else will accept them, we would work with them and accept them. Because like, for example, we have a client that, is 86 throughout the whole San Francisco. But as far as like she came to us, she signed up with us, and I mean she's actually, getting better and doing well. With the difficulty managing medications, we meet them where they're at. Whether if we do the weekly DOC, like Erica spoke about, some of our clients we do monthly DOC, some of them we do every day. Just all according to how they feel and what's comfortable for them, long as they're, adherent to their medication. And new to San Francisco, like with the Project Transition program, that we have a lot of new people coming to San Francisco, and if they meet the requirements, which, living with HIV and a woman of color, one of us do an intake on them, and we assess them and see and evaluate them and see like what needs do they need, and we help them. And I mean, next slide. Engagement and care. Once clients are enrolled with Trans Access, our team then supports them with the following: completing intake and needs assessments, connection to a primary team, drafting a treatment plan based on the client's needs and goals. Well, I'll kind of stop right there with like, as far as like, we do the intake and then we ask them like what they need with case management. Then connection, like at first, when I first started doing Trans Access, we're only dealing with Town-Waddell Urban Health Clinic. But now, since Soleil became the program manager, we have expanded with the case management. It could be any provider, whether it's from the wellness clinic, if it's from, Ward 86, any UCSF, like if they need their case management component, we accept any client and they can have whatever provider. So, and then for the drafting a treatment plan based on their needs and goals, what we do is every 6 months, we create a treatment plan, and what we do is we see what goals they want to meet, whether it's being adherence, if it's to stop substance use, is it to come to the doctor more, is it to engage in care more, like to come in and just, for like social support. And what we do is at the end of the 6 months period, we check like to see where they're at, or if they completed the goal, they'll come and report to us about the goal, and then they'll make another goal. So what we do is we start small. We don't try to seem so extensive when we first do it. So we start small with the client. Once they jump over that, then we do other goals. Developing an engagement plan to keep them connected with us, meaning like, well, for me, I'm gonna speak for my behalf, but keep an engagement plan. I'm kind of like a case manager, kind of family member, like that they don't have like in San Francisco, meaning like like what I do is that I'm the person that if they have no one to talk to, or even to talk for them, I'm the person they call. I check in with most of my clients every day. Even some of my clients have me as their emergency contact if anything happens to them. And then navigating any outside medical referrals they receive. With the medical referrals they receive, because with the nonprofit in San Francisco, like I'm gonna say for the medical part, like to be able to be seen faster is through referrals. And so like with Gender SF and like other organizations, like what we do is that we refer them out. Or like for example, I have connection with PRC. If a client needs some help through the Positive Resource Center, I have connections and I email them whether if they're a new client or not with PRC, and I get them connected to PRC services. Maintaining their medication and appointment adherence, and supporting with finding permanent housing or temporary housing. And with the supporting with finding permanent housing or temporary shelter, what I do is especially with new clients, I take them to adult coordinated entry. They do a housing assessment. And depending on their score, they could either have to go back in 6 months. They would have to probably requalify. They probably qualify, but like they probably qualify for a CAPU or permanent supportive housing. And next slide.
Do you want to talk about this a little more, Mia?
Okay, sure. Loss to follow-up. Sometimes a patient may reduce or stop their engagement with our team, and it is our priority that we keep them reconnected to services. Some of the ways we do this are by outreaching the client in the community, which we do wellness checks. We go to their their living situation, whether it's a shelter, their SRO. We do that. What I do is that if a client hasn't came in, like I will outreach them on Facebook. I'm gonna just be honest. I reach them and I get them connected to come back into care, like from like a social media platform. Like I've had those instances, and then we incentivize the reconnection. We incentivize them, to make it to any medical appointments if it's to re-engage back into care. And when they make maybe their first 2 or 3 appointments, then we just keep them going and we just make sure they stay in care and identify barriers and reset. What we do is with the identify barriers, what Soleil has taught me is that when we outreach them, the ones that haven't been in, it's best to see what's the main reason of why they're not coming in and try to assist them with why, as far as with the barrier, whether if it's transportation, whether they need a lift ride to make it to their medical appointment, whether if it's if they need access if they need access to food, or if they need a reminder, like they need you to call the day of the appointment, or the day before, just to confirm. So basically with the identifying barriers, mostly rides, I can say, and it be checking in with them, because the clients can be forgetful. In addition to trans access, has been able to increase clinic participation through our partnership with TransLink, which TransLink has been grateful for us, because with TransLink, it's a program in itself, and it's a support group, it's a mental health support group for the girls, and it's on the day of our clinic. So it gets clients to they're incentivized for the support group, so it gets the clients to come in to see the doctor. And we work hand in hand with the program manager of TransLink. So for example, when a client comes just a support group and they're not checking in with the doctor, the program manager of TransLink can let us know, and we kind of talk to the client okay, hey, you're coming in for this, you could see the doctor. And that's how we get them to re-engage in care. Because a lot of clients who wasn't even in care anymore, since we have TransLink every Thursday, that's how we get to see them and get to talk to them and check in and get them to come in and see the doctor. So next slide.
Erica, is there anything that you would want to add to this component?
Mia really kind of covered it. I mean, I just have with me, I have a particular patient that had disappeared from care for a long time and came back into care. And so when I met with them, I just, had a conversation with them. We were talking and I'm like, so where do you want to see yourself within 6 months, And she said that she wanted to be undetectable again. She said that she only had been undetectable one time, which was in the beginning she started her medication. I said, we can do that. I said, let's do that. And so we got her to undetectable and she's doing really well. There's different things that we do like that with certain patients, because every patient is different, how we have to interact with them and how we meet them halfway. But that was, yeah. And TransLink has been a blessing for us because it's on the same day as clinic. And we, like Mia said, we've gotten girls that have kind of stepped back from care, and being that they go to the support group, we were able to get them to re-engage again, which is a blessing. So thankful for TransLink.
And I think in all, this is one of the things that I really want to emphasize to any provider or person that's watching this. I think from kind of just talking about the services that we provide, we really strive to be and care for the whole person and every component of their identity, their complexity, their lived experience. And some of the things that we didn't get to mention was me and Erica have helped people get furniture. Me and Erica have helped people get food and find those resources. And I think another component that's really big is that transportation aspect. A lot of girls, sometimes they can't make it to the clinic, and it can be hard to sometimes get out of the Tenderloin, especially when you have a medical appointment that's all the way at UCSF, and it could be, and from our experience, some of them could be all the way across town. Not everyone has the capacity or the ability to make it to those places. And it's just really, really special. And I really want to urge anyone that's watching and listening to us right now to really think about the whole person and try to find, obviously everyone's services and what they're able to provide will be different, but I think that is one of the takeaways we really want to stress is that even if you aren't able to necessarily meet those needs, at least acknowledging them, at least recognizing that this is something impacting someone and that might affect their ability to show up in a capacity. And it's not necessarily that they don't want to, it's just that there's something that's preventing them or creating a block. In TransAccess, I think we have gotten to a really good point where we're able to identify those blocks and hopefully resolve them. And with all of that said, I want to thank you all so much for giving us the space to talk about this program. Yeah, and this is a photo with some of our clients. We had a barbecue at Golden Gate Park sometime, I want to say it was in like the summer of last year. And so these are some of our girls that are with us. But thank y'all.
That is lovely. Thank you so much, Soleil, Mia, Erica. Thank you, thank you, thank you, thank you. I think that when we think about harm reduction, this is what harm reduction looks like. So talk about meeting people where they're at, right? And as someone who has worked offering services to the trans community, I know this is just a 10% of all the amazing work that you guys do every single day. So thank you for the work that you do in serving your communities. Thank you. All right. So we're not done yet. Now we're going to be pivoting into our panel discussion. So Soleil, take it away whenever you're ready.
Sweet. So to give a little context, I'm going to go through some questions that we have. And for anyone that's in the chat or that is watching, feel free to submit any questions and we can go through them. I see that we got one. Let's see. So this person asks, as providers, how can we combat medical mistrust for trans folks? Mia or Erica, do y'all want to speak to the
You said, how can, as providers, combat medical mistrust?
for trans folks?
I can say what I've like discovered with something like with that is that you have to make whatever you do with the clients, you have to make it realistic. Like it has to be realistic goals, and they have to see some type of progress. Because with trans, what I've noticed with a lot of us trans people, we're so used to being let down and sitting still in one spot and not seeing us elevate. So when we see like 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 the same thing keep happening over and over, like we don't, it gets to a point we don't believe nothing nobody new say that comes in our life, because it's like, okay, this is, we're gonna look at the key pointers that, from the previous person that lets us down. So I can say with the medical mistrust is to actually be realistic about whatever goals they want to meet. Like, and if you can't help them meet the goals, help them in an area of their life to be impactful. I want to say to be impactful for something they can learn from. Because like I can just say, like, the patients, when it comes to it, it's like they're hard-headed, but they're like one of those kind of hard-headed people. They're like hard-headed people that they have to bump their head one time and maybe they'll get it, or maybe they'll see we'll have to just like see a different view. They would have to see a different view.
Wait.
What about you, Erica?
For me, yes. I mean, you have to, like do things that are realistic that you can achieve with them. I mean, don't try to go too way out of the box. And then because if you're not able to achieve it, it's just that disappointment where it just puts them back in that headspace. Like Amia said, we're so used to being let down or just being put to the side and to wait. And so it's good to just, choose things that you can do. I mean, and if you can't do it, be honest and let them know that, that it's not within your scope, that you cannot do that. Maybe you can head them in the direction with someone that can, but yeah, not to make any promises that you cannot keep, because that's one of the main things that the ladies get really disappointed with. And yes.
And also, like, I mean, I didn't give any examples. Like, examples are dealing with new patients. ask them their pronouns, see what their pronouns is. Because even myself being trans, like some people, I've said the wrong pronouns. Like I've said he or she in this day. So like, like starting small, figuring out their pronouns, and making sure that whoever's on the medical team, they know, like they're trans inclusive and they know about trans people, and just and as far as like see where they're at, whether if they want to socially transition or if they want to medically transition. And so, like with the medically transition, that's kind of like working with the surgeries and stuff like that. Just let them know with the surgeries or anything that you're there, like you're there for them, and it could like give them at least to a consultation.
And then thank you, Mia and Erica. And then we have a couple of other questions. What are the unique healthcare challenges faced by Black transgender women aging with HIV in the Bay Area, and how can providers better address these needs?
Okay, well, some healthcare challenges is dealing with mental health, stigma, um, dealing with um dealing with trauma-informed care, um, and how could they better address those needs is, give me one second. Erica, you,
Yeah.
you could, would you like to answer the question, Erica?
I would say we could also talk to the experience that some of our like clients have shared with us.
Okay.
I think that is something that we can do. Um, I think from what I know from some of our patients and some of the conversations that we've had for them, for a lot of the girls, like there's a level of discomfort, and they, in more cases than not, um, there can be a lot of like discrimination in the health system, especially in San Francisco. And for some of our patients, like when it's come to supporting them to appointments and being there to advocate for them when they need it, like there's been so many instances that I have seen and witnessed where one of our girls was experiencing anti-blackness within or from a medical provider. And I think that is one of like the biggest things, that there's a lot of racism that affects the way that healthcare is provided, and that can really and greatly skew the care that our girls receive. And so I think that from our work and a lot of the conversations that I've had, that is where a lot of distress comes from. A lot of the girls feel like they aren't going to have their needs met or acknowledged, and that they're going to be dismissed and it's not going to be taken seriously. And um, I think that is one of the most prevalent challenges that I
I
have
do have one.
heard my girls share.
So I think one that we have come across, both me and Mia, is with aging, what do you call it, transgender women living with HIV. They seem to be uncomfortable in the beginning with Mia because she's young. And so they don't like kind of like take her direction. So I would, help her and step in because being that I'm the oldest one in the group. And plus I know a lot of the ladies, just kind of smooth the way to, trust her, you know what I mean? And eventually she's able to build that relationship with our aging trans women that come to our clinic. Um, I think for me, what works for me is because they're relatable to me because I know a lot of the ladies that come to the clinic. I've known them for many years. Been out there with them, standing on the street corner or in divas. So I'm relatable, but like with Mia, because she's young and fresh. You know what I mean? Some of the older, what do you call it, patients feel kind of like uncomfortable. You're so young and everything, but once we smooth that, that away, I mean, eventually they open up to Mia because Mia's a great medical case manager.
I must say, like thinking of a chiming from that, what it is for me, like they like with client our patients, they want to feel independent. And so
Mhm.
with clients that's Asian and HIV, me coming around is just like, okay, what are you around for, little girl? Like I got this. I know what I've been doing. I've been like doing this for years. Like, cause we had a client that like literally like was like I feel like what also they deal with shame of whatever they're going through or whatever like they have to deal with in the healthcare system. And so for us, like it's kind of like a barrier for us because we can't speak to the providers to give them the services they need around whatever they're shame about. So, like, as far as like how you can better address those needs, just be consistent with the patients. Be consistent with them. Let them go, like move at their pace, and build rapport with them, and kind of get to know them on their basis, and they'll come around. Because like every client that I probably started out hard with, like it started out they didn't want to tell me too much. They wanted to kind of keep it real, just surface. Like when it came down to it, like it was like kind of I was the only person they can talk to be able to help them with the provider, or it was it was one of those things that it's nobody else in their corner and they're realizing it, so it's like, okay, well, we need the trans access team to help us.
Mhm. Yeah, thank you, Mia and Erica. This next question that I have is for Mia. Can you share some of your personal experiences navigating aging with HIV as a Black transgender woman in the Bay Area? What have been some of your sources of strength?
Nonprofit organizations. Also, what else? Like as far as like you could say community, because like for me, like moving out here, I had no family. I had nothing. So like when it came, like when I first was out here, the first year I moved here in 2021 for like Thanksgiving, like I cried because like that was my first time being away from home and away from like all my family members. And so for me, kind of, being a client of San Francisco Community Health Center and Trans Thrive having their Transgiving, it actually made me feel like I had a giving family, because like I had no one else. So, I looked at the time I looked at Erica like an aunt, like, cause I went to her for everything, and like she made sure I was straight. So yeah, community was one. And then also like as far as like events, like galas, like being able to network and to being able to meet, people from other organizations. Um, and school, City College. Like that was my fourth time going to college. I actually finished. Like I'm interested in going back to school. And like they just I don't know. Like for me, like it's just the sources of like strength that I had was also within myself. Cause moving out here and like not having anything, no way to get home, like I was set, like, I mean, coming to this agency, it put me on a platform. And what I was told was like in the nonprofit world is doors. So you have to walk through all the doors. And so that's how I got introduced to CJJP, St. James Infirmary, the Hope Center, San Francisco AIDS Foundation, PRC, like all of it. And they all, for me, they helped me in a different component. Because I mean, I was homeless. I was homeless. I had no clothes. Thanks to Trans Thrive She Boutique, I had clothes. I couldn't call my mom. So like it's just I can say for me it kind of went fast, but I just kept going and kept going and kept going. And like to say I didn't know what I wanted, this is what kind of like fell into my lap. That's why when anyone asks me if why I moved here, it's just like a leap of faith, because I knew nothing about San Francisco. I knew nothing about gender affirming care, because where I'm from, you have to pay for it. Like a doctor would not prescribe you hormones. So like me, like Dr. Lin, meeting him, like my first visit, I cried because he understood me, and he was like right by my side, like on whatever decision I wanted, whatever I wanted to do, like, and so like that healthcare system is great.
Thank you for sharing that. For the next question, how does the intersection of racial identity, gender identity, and HIV status influence your experiences and access to resources?
Um, it makes you like with that, it makes you want to go to like it makes you like certain services you don't want to go, you don't want to show up to because you feel like stigma from that, a particular crowd of people. Um I mean, but access to resources, I can honestly say, um, it makes it like living with HIV, gender identity, like it helps you get a lot. Like I'm gonna just be honest, it helps you like with the like as far as like gender affirming care, it like as far as like with the access to resources, because there's a lot of resources if you're living with HIV and you're a trans person. Um, also, like as far as my experiences, it's just I see stuff in a different light with the, as far as like with my like gender identity and stuff like that. Because like out here, like it's a lot of trans people. Where I'm from is like two, three trans people. So like I wasn't accustomed to like like a bunch of trans people. So um yeah, so my experiences like with community, for example,
Mhm.
like that's how I got to understand other girls, where they came from, how to relate. Like, and I just, what I learned that is that like no matter what age you transition at, every all girls have a similar experience, whether it's the beginning when they're first becoming trans, when they're first transitioning, like whether if they were a streetwalker or they escorted, like so for me like it influenced me knowing about other girls and relating to other girls in the community.
Thank you for sharing that.
I'd like to
Uh,
add on to that if possible.
for sure.
So, for me, like originally when I came to the agency where I was getting my care, it was API Wellness. Um, Originally, I was getting my care. The first year that I started my care, I was going to Highland in the East Bay. And I was reluctant to go to API Wellness because I'm Filipino, I'm Asian. And, there was a lot of girls that worked there. And, I had a lot of fear. But eventually, when I went there and I did my intake, I think the staff that they had there really put my mind at ease that I wouldn't have to worry about like because back then, I mean, if you were, HIV positive, the girls and I was a sex worker, they gossip and things like that. And so I was like really had a lot of fear about getting my care there, at the agency. And it's when I met with the staff and they just felt, welcomed me and everything, it really just put my mind at ease. And I mean, I stayed there for 16 years. So, I mean, I got the care that I needed. It's not the story that a lot of people have, getting health care. But for me, I feel really blessed. My first case manager was a miracle worker. She just, everything she promised that she would get from me, she did. And I mean, they had great doctors. I mean, yeah, it was just, I think really I feel blessed that I was lucky that, I came across the agency. At first that I was really, really adamant that I didn't want to go there because there was a lot of Filipinos that worked there and I was scared. But once I went there, it totally, yeah. It was the way they did the intake and the people that I met in the very beginning as I was starting to go there or thinking about going there that really made a difference with me taking my care seriously because I did in the beginning. So
So Erica, I'm gonna say what you saying that like as far as like how they made you feel with the intake and stuff like that. As y'all should know, Erica was when I was a client of Trans Access, Erica was actually my case manager, and she was the first person to ever do an intake on me in San Francisco. And so she would always say, like, after I started working with her and stuff, like, she would say, like, she saw a light in me, and she would just tell me, like, just do the footwork. Whatever they want you to do, just do it. And so I just went along with what she said. And once I went along with what she said, like, and I started going to school, and I was like, after I told her I didn't want to go to school, she told me, she was just like, she said you worked more than what I thought I expected. I'm shocked. Like, she was like, I had like it was a certain thing set out for you. You worked past that. Like, I'm amazed. And it's just like, cause I didn't even like when she was telling me to go and pass out COVID masks and volunteer, I didn't know there was a part of being like a case manager and doing community work and outreaching, because I never knew outreaching from Louisiana. I never knew that. So a lot of the things that I was learning with like CLR, our community living room at San Francisco Community Health Center, it was a part of being, like a patient navigator, a care support navigator, a housing specialist, like, and that's how I learned the tenderloin. I learned the tenderloin with passing out COVID masks and COVID tests. So like it wasn't just community, it was the whole San Francisco was, I'm gonna say the tenderloin itself. I learned, and and that's how I kind of learned like a lot of the different organizations like Glide in St. Anthony's in San Francisco. Was I didn't know nothing about the Tenderloin. When I first got here, the Tenderloin scared me. And so I kind of started going to the agency, and then Erica was just like, the only way you're gonna learn this and you're gonna feel comfortable is if you go do outreach. If and so I would on weekends, I would go do street assessments with her in the Tenderloin, where we would just walk up to people, hey, you wanna do an assessment? And we'll do an assessment. And so like for me, that was one of my influences as far as like with experience in San Francisco, moving here and accessing, and giving and like helping people with resources and getting them connected to resources as well as myself.
And I think to just recap, so essentially from what you both shared, navigating the resources in SF were a lot different from, at least for Mia, it was a lot different than what you were used to back in Louisiana. And there was not only more for you here, but it was like a little bit easier at least to access those things.
Yeah, like I mean, it's just like and like because with my clients, like why it's so trans access is so special to me is because I was a client of trans access. So the things that they do, I was there. Like when not taking my meds, not missing appointments. So like what it is easy when you want to do your part of the work. Meaning what made it easier for me of accessing resources and getting where I'm at today, it was that it was it was handed out to me, it was told to me, but I had to do everything else. Like I had to, come in, I had to, attend the appointments, I had to, stop using substances, I had to do all those different things, so it's given to anyone that's new to San Francisco, but the thing is that I would suggest that anybody if they want to see it actually happen, they have to be willing to sacrifice everything and let all their ego and everything go to be able to successfully live in San Francisco.
Thank you so much for sharing and speaking to these questions, both of you. This is also one of my the most special things that I've gotten to experience as a program manager is I get to have these conversations with me and Erica, and I get to hear about their experiences in addition to the girls that we serve. And so this is a very special moment, and thank you both for being vulnerable and for speaking to your truth. And I'm so proud of both of y'all. And with that said, I'm gonna pass things back to Fabian and we can continue.
Thank you so much. And I think, Soleil, you have actually expressed exactly what I wanted to say. This is not just like oh, let's change it back to the different type of topic that we have moving forward. This is a conversation that is really important. This is a conversation that, impacts people's lives. And you have shown to do it and express it and open your hearts and your stories with so much grace. So thank you so much for doing that. So I think now, as we conclude, we want to have a little bit of time, kind of like 5 minutes, 4 more minutes, or 10 more minutes to address some of our questions through the Q&A. So, Darrell, how about you take us there?
I am right here. So we have a few more questions. One of those questions is how we're going to ask providers, how can we do better in making our agencies an option for trans folks?
I can
Um,
say something. Are you gonna say something, Mia? You wanna go first?
You can go first. You can actually go
So
first.
I think really what's important, what makes it really important is that they see themselves somewhere within the staff, with the people that are working with them. It's really important to have representation there. I think it's like, yeah, it's my superpower, working with Trans Access and just being a part of the agency is they see, I know a lot of the girls, you know what I mean? They know me, and I try to inspire girls to make them, that they can do it too. I mean, it took me a long time, but it's doable. You just have to take the first step, pretty much.
I'm gonna say with, as far as for healthcare providers, what will be helpful is to use correct names and pronouns, regardless of their legal name. Avoid assumptions. Don't assume nothing about them. Let them tell you, like, what's going on. And then also, I have it written down. And then also inclusive language, like knowing, inclusive, like using the word partner and not like, husband and wife, like just kind of like, and then just kind of being like aware of like how trans people communicate, like build your own communication with them, like one-on-one, like as far as like y'all understand each other, and like that will be helpful too, like, working in the healthcare system with trans people.
Wonderful. Thank you. Thank you for that. One more question is, is that sorry, if I misgender someone, how can I come back from that?
You apologize.
Uh,
You apologize, you let them know it's a mistake, and what you do is then you ask the question again, and then you say the correct pronoun. Moving forward.
all right. Thank you for that. And okay, and the last question is a two-part question. It is what what is pretty privilege or passing privilege, and is that a real thing? And if so, how does that impact people's lives? Oh, you're on mute. You're on mute.
I
You
couldn't
said
hear the
a
question, the sound went out.
say the question again.
Pretty, yeah. What is what is it? A pretty privilege or passing privilege? And is this a real thing? And if so, how much does that impact someone's life?
Okay, so when you say pretty privilege and passing privilege, that's being trans in general, correct?
Yes.
Okay, so with the pretty and passing privilege, yes, it has its perks. Like it does have its perks, because like if you're a person that you want to be kind of like incognito about your trans status, then yes, like being pretty and having a passing privilege, yes, that's a real thing. Yes, you could be able to do that. But then like as far as like other, like, because me personally, I commend any trans girl. Why? Because like we're bold to sit up here to wake up to want to do this, and like in the beginning, no girl starts off cute or pretty in the beginning, and it's just kind of like you have to deal with society whether to accept you or not, whether if you're passable or not. So like it could be like being trans is a big thing. Like it's not like, that's why I commend the girls and the guys, because it's just kind of like we go into the world taking our acceptance from people, not waiting for acceptance from people or validation, because doing that, like, society will let us down. Because like I'm gonna just say this, from being pretty and passable, like, yeah, it has its perks in, like, the public, but like when it comes down to it, you're still let down, just like any other trans person.
Okay. Thank you, man. Thank you for that. Okay. Does anyone want to add to that?
I can. So
Yeah.
as for
Thank
me, is it someone? Okay,
Yeah.
so as
Yeah.
for me, yeah, it does have its perks and everything. I mean, like originally I was the type of girl that wanted to stay stealth, so I like to blend in. didn't participate in anything that had to do with community, didn't go to Pride, things like that. But as time went on, I realized the importance of it. And it's, how could I put it? There's so many facets to gender expression now. So it's like you can't put one thing in one place now. So, I mean, really, you just have to be really open. I mean, and it like Mia said, it takes a lot of courage to start this. I mean, I started with a flat top, you know, and then grew my hair out, couldn't wear wigs, you know what I mean? So, I mean, yeah, it takes a lot of courage to be, you know, to be trans and everything. It's not like yeah, it's not like eating cake, honey, and you know, just like you know, it's a process, you know what I mean? And I had my good days and I had my bad days, but it's how you navigate through it. I mean, and you just have to be mindful. I mean, like I said, there's so many facets to gender expression now. You have to be kind and just mindful. Yes.
Nice. Okay. Thank you, Erica. Thank you, Mia, too. Thank you, Soleil, too.
Those are
Thank you.
core values to like a takeaway message. Be kind, be respectful, be empathetic. Thank
Yeah.
you.
And
Thank
those
you
are the
both.
questions.
And be cultural competent.
And be culturally competent. Yes. Yes. Thank
All
you
right.
so
Thank
much.
you all.
All right. So, with that being said, thank you so much to the team. We went through the questions and answers, Q&A. We just want to share our gratitude to Soleil, Mia, and Erica, and all the people who do an amazing work every day serving the trans and queer and non-binary communities. Trans Access at the San Francisco Community Health Center. Thank you so much for being part of this conversation, for being courageous enough to open yourselves and talk about your life experiences, your stories, your struggles, but also your excellence. Um, Showing us that, you know, the trans community is not a one side of the coin, that is very diverse in many ways. So thank you for doing that. And I think these are conversations that we have to continue having, that it doesn't stop here, right? And Jen, I see your hand. Yes.
Can you hear me? I have questions for the panelists. They're in the Q&A.
Yes,
Can I ask
please.
them? Okay.
Uh,
Hey, y'all. I just wanted to tell you, I really love the passion that you all have for this work. And I love that you kind of asked, you were talking about like this whole holistic approach when you were talking earlier. And I wanted to know if you could share more on how providers can adopt a more holistic and intersectional approach that affirms both gender identity and HIV status. And I actually have one more question. You may have already answered it, but that's one of my questions. So I was wondering if Mia, Erica, or Soleil, anyone can answer that question. Thank you.
yeah, thank you so much, Jen.
If they're still there.
Okay, I can say with that question, you have to like actually study and learn about trans people. Like, you know, learn the history of them, learn what's what the latest thing that's going on in society with trans people.
Yeah.
Also as far as like with the HIV, I would say you would have to like, I mean, which as a medical provider, you would just have to be skilled in, you know, working with trans people and working in the HIV system and putting them together and working at a working better to support them with their, because like, and also mental health. You have to be mindful of the trans people mental health.
I would also say, to add into that, something that I think is like really important is to just know people, know trans people in your real life. Like, it's one thing to work with them and do the work for them, but it's another thing to actually have trans friends, trans family members, like have that physical experience. When you share community with someone outside of just a work space, like that gives you so much more context to the community, to transness. And there's so many things that I've learned about this experience through my peers, my sisters, my brothers, siblings, whichever. And a lot of the reasons why I was able to find such a solid footing in my own identity is because of that component, is like talking to the trans people in my life, finding trans people in my community and just engaging with them. Um, and I think in general, like one of the things that has been especially helpful for me to affirm people and also like be respectful and mindful of their status is to just ask them how they feel about things and let them be the person that's leading conversations, or um, being able to tell you what they want and what they need, and um, finding ways to uplift that versus dismiss it. And like I think that's one thing that's really, really impactful, is especially if someone is coming to us and talking to about either of those things. I think just ultimately affirming that.
Mhm, mhm.
And just also, I would say to chime off that is to actually roll resistance to whatever decision that they make. Like, just don't look down, like don't make them feel like you're looking down on them. Because like looking down on a trans person is gonna push the person away.
That's true.
Were you gonna add anything, Erica? I just saw you.
Yeah, I mean, for me, I'm naturally a nurturing person if you're part of like my family, my chosen
Mhm.
family. But I use my life experiences actually as part of a tool that I use when I'm working with patients, especially when
Mm.
I meet a patient that actually has maybe a similar story to what I went through. And I think that's what really helps me, come from like maybe a holistic approach with things. It's my life experience. So, like, I
Right.
mean, speaking to attest to what Mia was saying, that I saw a spark in her. When I met her, she had a suitcase and she came in. And when I was talking to her, I just saw myself where I was when I decided to, change my life. And so when I was done doing the intake with her, I went and talked to a couple of my colleagues. I said, we need to help this girl. She's new here. And, if she gets turned down or disappointed with like, things that, that she wants to do, she's just going to become the statistic with all the other ladies, and we don't want that. I said, there's something special in her. And so we worked really hard, to make sure that she was okay. And I mean, look at her now. She's thriving in San
Yeah,
Francisco, mind you. That's hard to
exactly.
do.
Totally. I agree. I agree. And this kind of adds to what you all are speaking to already, but I was also thinking about, what about folks who are maybe new to this work? Particularly thinking of folks who are cis and not trans, and also obviously maybe not a person of color. What would be one helpful tip that you might give them if they're new working with this community, particularly trans women of color who maybe are aging and living with HIV? I know you talked a little bit about this earlier, but if you all could just like close it out with like one tip, particularly for those who aren't trans, who aren't bringing that to the table when they have that person across from them, like you all just mentioned.
I would say what Soleil said as far as like let them lead the conversation.
Mm-hmm.
Like let them like I would let the new providers know like this that are cis, let the client know that you're inexperienced with their situation, like as far as like like
Mm-hmm.
wanna learn from them basically. I want to put it like just kind of just have an open just have an open ear and a big heart, and like and like it'll probably be I can say it will be hard at first because trans people, we could be kind of like when we're meeting we're big on when we meet new people. So like just I'm gonna say like when being a new person that don't know anything about trans people, just kind of go off of like just do some reflective listening
Mm-hmm.
and just ask reflective questions and just kind of like it's just like really just kind of like learning a person. Like, don't treat them like most like trans people. We don't want to be feel like we treated trans. We just want to feel like, well, for myself or like probably maybe Erica. We just want to feel equal to whatever services that we're getting. So just make them feel that they're equal like everyone else, any other patient in the healthcare system.
You can't see me. I'm giving you snaps, just so you know.
I think like for me, what I would suggest if it's someone new that's new and it's all new to them, I mean, just to really ask questions, you know, behind the scenes before you start interacting with anyone that is trans in your, you know, your staff or your team.
Mhm.
If you're uncertain about things, just ask questions because the only way you're gonna know is if you ask, you know what I mean?
Or ask
So,
for support, or ask for support from your other colleagues to help you with the
yes.
person.
Right, right. Thank you for that, y'all. I love that. Big heart, big ear. Snaps all around. Thank you.
Thank you so much. So with that, I think we can conclude today's webinar session. Thank you so much, Mia, Erica, Soleil. Thank you, thank you, thank you.